Chloe, do you give permission to be in my video? Can you say yes?
Yeah.
My name is Eric Thompson. I'm a nursing student at the University of Toledo. What is your name?
Chloe Black.
What is your birth date?
May 17, 2000.
And I'll also check her wristband as a second identifier. I'll wash my hands and apply gloves as needed. Today I'm going to be assessing your heart sounds and also assessing your upper and lower extremities. I'll provide the patient with privacy as needed. Do you have any history or current illnesses such as COPD
No.
or asthma?
No.
Do you have any history of heart attack or stroke?
No.
Okay. I'm going to go ahead and listen to your heart. Is it okay if I touch you today?
Mm-hmm.
Okay. Alright, I'm going to start with the aortic. So I'm going to go 2 intercostal spaces down. And then I'm going to go right to sternal border. And then I'm going to go to the pulmonic, which is 2nd intercostal space, left to sternal border. And I'm going to go 3 intercostal spaces down for Erb's point. And that will be left of sternal border. And I'm going to go to the 4th intercostal space. And that will be tricuspid. And then I'll go to the 5th intercostal space. And I'll listen to the mitral, mid-clavicular. I can hear the normal S1 and S2 sounds. I don't hear any S3 or S4. I don't hear any murmurs or abnormalities. The rhythm is regular, so I'm going to go ahead and count the heart rate. So I will count for 30 seconds and multiply times 2. Your heart rate was 70 beats per minute, which is in the normal range of 60 to 100 beats per minute. Next, I'm going to move on to just assessing your arms. So if you could, so I'm going to check that her arms are symmetrical and equal in length and size bilaterally. I'm not noting any redness or inflammation on either arm. I don't see any open lesions. There are primary lesions. They seem to be distributed evenly on both arms. There is a secondary lesion. She has a tattoo on her upper right extremity. Alright, next, I'm going to check your strength. So if you can, just go ahead and squeeze. Okay. Her strength is equal bilaterally. and it is strong. Next, I'm going to move on to examining your lower extremities. So if you could, just go ahead and lay down for me. First thing I'm going to do when I'm looking at her legs, I can note the color of her legs is a light tan on both legs. And there is no color variations. It's all just one color throughout. The hair follicles on her legs, I can see that she is shaved. Her hair follicles are evenly distributed across her legs. There is some venous patterning on her legs as well. And that is mainly on her lateral thighs on each side. I am not noting next I can move on to lesions. There is some primary lesions in the form of freckles on both of her legs. Those are evenly distributed. There is a mole on her right leg, right beside her patella, and it is lateral. The size of the mole is about the size of a pencil eraser, and it is round. There is a birthmark on her lower right leg, lateral, and she does have some scarring as well. And I'm not noting any other secondary lesions at this time. And I'm not seeing any vascular lesions. I don't see any bruising on either leg. And her legs are both equal in size. They are symmetrical. Next, I'm going to go ahead and I'm going to check the tibial pulse on both ankles. On her right leg, the pulse is there. Her tibial pulse is there. I'll rate that. It's kind of weak. I'd rate it as a +1. Her left leg, the pulse is also a +1, and it is elastic as well. Next, I'm going to check her dorsalis pedis pulse. The pulse is elastic, and I'll give that a +2. It is strong on her left leg, on her left foot. The dorsalis pedis pulse on her right foot is also a +2. It is strong, and it is elastic. Next, I'm going to check for any ulcers on her legs. So I'll check the back of her heels. Look for any signs of ulcerations. I'll look between her toes for any ulcerations or lesions. with extremities are clear of any ulcerations at this time. Next, I'm going to check for any edema and swelling. So, check for edema. I'm just going to go ahead and squeeze down. I'm going to be checking for any pitting as I go down. I'm not noting any pitting at this time. So there is no edema. I'll check for moisture, so I'll just use the back of my hand on both legs. The right leg is not moist, it is dry and it is warm. The left leg is also dry and warm, so there are no signs of moisture on either leg. Do you have any numbness or tingling in either extremity at this time?
No.
Not in your legs, feet, toes, nothing like that?
No.
Okay. How about your either arm? Do you have any numbness or tingling in either arm?
No.
Okay. Next, I'm going to put the bed in the lowest position. I'm going to make sure that my patient is comfortable. I'm going to put the bed rails up ×2. I'm going to make sure that the call light is within reach and that my patient does have any belongings in reach as well. I will then document all of my findings for my assessment.